Welcome back to the Non-Traditional Veterinarian. I am the Non-Traditional Veterinarian, Dr. Bimonte. I've been asked by a handful of individuals, can you talk about your story, how you got here? Was there anything you learned in vet school that maybe you didn't agree with? Have you always thought this way? How have you taken this maybe non-traditional approach where you are combining the good of the traditional convention side and the good of the maybe more holistic, integrative, and really combining them to be truly integrative? And what I can say is I don't think there's anything in vet school that I don't agree with. I think that vet school gives you a good foundation. What I can say is that along the way in my 11 years in practice, I've been able to mold how I want to practice. So let's start from the very beginning. So I went to vet school in Tuskegee, Alabama. I went to Tuskegee University School of Veterinary Medicine, graduated in 2014, went straight into practice literally like weeks later and joined a true mixed animal practice where my former boss, who I keep in touch with, said that's when I was practicing real medicine. And I joke with that because it's like the James Harriet is what we were. So we did large animal, horses, cows, goats, sheep, pigs, alpacas. We did small animal, dogs, cats, some exotics here and there, like rabbits, but mainly that was it. And so we were a true mixed animal practice. I did on call. I would work and then we would rotate on call. And I think it was a really great opportunity right out of vet school. I think it really helped build on the foundation that I was able to receive through my experience of education. I was very fortunate at the time, it seemed like a lot, but I was very fortunate at the time that the program I went through for vet school was very hands-on, very, very hands-on. We didn't have residents. We had one intern for small animal, one for large animal. And so we students got a lot of hands-on experience, which for me, it was really great because it was very real world. I didn't have the specialist to lean on because that was very realistic for what I was going to experience. And so I joined this practice. I was there for a year and decided I wanted to come back home to Florida. This practice was in South Georgia. I still stay in contact with them. That place is like a second home to me. And moved to the west coast of Florida and started practicing small animal medicine in a very general small practice, a very conventional small practice. Was there for not a little over a year. Decided I wanted to work closer to where I was living. Practiced there for 3.5 years. And at that practice, that was the first time I had been exposed to a relief veterinarian. And if you're not familiar with the term, it is essentially a travel veterinarian who goes and provides relief to the hospitals, whether that is for staff shortages, vacations, maternity leave, paternity leave, growth purposes, single doctor practices who need a day off, chemo treatments. I mean, you name it, I have probably covered it. And so that's what I do now. I'm a relief travel veterinarian. I had never even heard of the role or the career path until I was at that third hospital that I worked at. And that was the first time I'd ever worked with veterinarians like that. And I used to look at them and be like, oh my gosh, like, how do you do it? Like, I'm thankful to work with you. Also, how do you do it? That you're at different practices. And I was someone that was convinced that I needed structure and routine and expectations to be met. And I realized during my 3.5 years there that maybe being my own boss and being a relief travel veterinarian was exactly what I had been looking for. And so I made the decision after being there 3.5 years. So I was in practice 6 years, about 6.5 years, to go out on my own. I gave my notice January, I don't remember the exact date, but it was like January 26th or 27th of 2020. It was the end of January 2020. My last day there was like March 16th, 2020. Crazy time, right? I had a lot of people that were like, you're crazy, you're leaving benefits, the world is crazy right now. What happens if you don't have work? And I will tell you, I had no lack of work in 2020. And so it was a little untraditional or non-traditional for me to take that path. Relief veterinarians were not as popular or well known as I feel like they are now, over 5 years later. And so that was very non-traditional for me to take that path to just not join a general practice, work for them, be an associate, and maybe have a piece of the pie, maybe partner. I decided I wanted to go out on my own. I decided I wanted to have more control over my schedule. I have more control over what holidays I got to spend with loved ones, had more control over when I got to take vacation. had more control over where I was working, who I was working with, what those hours were. And so I wanted more say in that. And I knew if I didn't like it, I'd already experienced a very traditional path. I could always go back to it. And so I fell in love with it. Loved being able to have that freedom and flexibility and really, truly being exposed to so many different types of practices, so many different types of teams and team skill sets and clients and pets. I was exposed to so much. I also felt very ready being out 6.5 years. I felt ready to be a relief travel veterinarian because sometimes you are the only doctor there and you were it. You were the captain. You were steering that ship. And sometimes your team isn't as experienced as maybe other teams are. And so you maybe have to do a little bit more tasks or a little bit more critical thinking or provide a little bit more support and maybe even teach them. And so I think the timing was wonderful for me to go out on my own and for me to really sink into my skills. And that is when I started to be exposed to more pet owners, talking to more pet owners, and realizing that there was this shift going on where dog owners were paying more attention to their dog's food and they were wanting to feed their dogs food that they could cook. And I saw this trend happening. I kind of took a step back and I was like, okay, I'm seeing this, and it's not just at this one hospital. It's not like because I'm in a certain area of town or a certain part of the state. And I was like, you know what? I want to get ahead of this. I see this trend happening, and I don't want to be behind the curveball because this is something very interesting to me. And shortly after me becoming a relief travel veterinarian, I started seeing a functional doctor. And the reason for that was I had developed a very severe dairy allergy that was diagnosed June 2019. I had had no history of even seasonal allergies before, food sensitivities. I had had no issues, no history, no family history. And so it kind of came out of nowhere. And when I say it came out of nowhere, I'd had a really bad cold December 2018. I mean, it kicked my butt. To the first time, I think it was the first time I had called out of work for being sick in my career. So I'd been out of school almost 4.5 years at that point. And I was sick as a dog. And after that, my stomach was just not the same. And so I had a suspicion that I had a dairy allergy. Went and saw a primary care doctor who was very kind, however, never even put their hands on me for my physical exam. Then I went to go see an allergist. The allergist dismissed my concerns for my allergy, saying that someone your age doesn't just develop a dairy allergy. I don't think you need to be tested. And I said, with all due respect, I understand that you're the doctor here and this is your expertise. I've already gotten it approved from insurance. I'm here. I'm on my lunch break. This is the only time I can come in with your availability. Can we just get to the bottom of this? They did the skin test. And if that man could have walked back in the room with his tail between his legs, he would have. I went into, I don't even know if you could say borderline because I feel like it's either it is or it's not, a form of anaphylaxis in the room after my skin during my skin test. My throat started to close, it started to get very itchy. I mean, I was literally scratching myself raw. I was having to sit on my hands because I just wanted to scratch my arms where the test was. And I was making myself bleed. I could not stop itching. And of course, I was probably itching more because I was scratching myself. It was not what I was expecting. Surely was not what he was expecting. And I left there with a prescription for 2 EpiPens and was told, do not eat dairy and carry these EpiPens. And I knew in my gut, no pun intended, that there had to be some way to help repair this. I had to be able to use food for medicinal purposes. And it couldn't just be that this is what it was. So I went to a gastroenterologist because I was like, all right, I feel like I have to heal my gut. Gastroenterologist was like, why are you here? Go to the allergist. And I went back to the allergist. They're like, you should see the gastroenterologist. And I was like, okay, I'm hot potato here and y'all are just tossing me around. Luckily, around that same time, a colleague of mine had talked to me about a functional doctor, functional medicine doctor. And I made an appointment. I'd never seen one before. Made an appointment. Took me about 3 months to get in. And sitting down with her, I met with her for about an hour and a half. She went over my whole medical history. And I felt seen and heard for the first time. I felt so validated and that, hey, we can make you better. She's like, I can't promise you that you'll be able to eat dairy again, but we can help do tests, see where you're at. How can we heal your gut? And that's what started this whole journey of my health, which helped me think about, well, what about my patients? What about my patients that are dealing with allergies or chronic issues? What can food do for them? And so that's between seeing the trend of being at all these different hospitals and seeing owners that are like, oh, I cook for my dog, and them telling me what they were cooking. And I'm like, I know that that's not formulated to be balanced. I don't know how. I'm gonna learn. And seeing what it did for my own health, I was like, there's gotta be something to this here. There's gotta be something of importance. And so I would do what's called, I guess you could say, going down the rabbit hole. And I enrolled in a reputable food therapy course through Chi University and went through that, went through all the tests and sat through it, passed it, learned a lot of information. And then from there, my craving, no pun intended, for nutrition for my patients was found, and was trying to put myself in the room of as many nutrition courses and information and education as I could, whether that was a 2-hour education, continuing education lecture, or that was a 12-hour continuing education course where it was credited for 12 hours, certifications and tests, whatever it was. And I wasn't just going from the integrative holistic approach. I went traditional, I went conventional. I wanted to learn about all of it so I could take the good and leave the bad, or take the good and leave what I didn't prefer and make it my own based on everything that I had learned, not just my own speculations, but okay, here's repeated evidence for this. Here's repeated information. Here's repeated teachings for this. And that's how it came about. And then a few years later is when I entered my own journey and being a little non-traditional and being a relief travel veterinarian. Now to this date, I'm licensed in Florida, Texas, South Carolina, Georgia, Maryland. I have physically practiced in 4 of those states, and I have seen a lot, and I've talked to a lot of pet owners. I have worked in probably close to 75 different hospitals now, which means I've worked with a variety of teams, team experience levels, other doctors' experiences, new grads, retirees, or about to retire, techs that have been techs longer than I've been a doctor, techs that are just new and fresh out of school and have new education. All of it, to rural, to very urban, to very boutique, to very low cost. I have been in almost every situation known to man. And I really am very appreciative of that because it has allowed for me to have such a panoramic, holistic perspective on having this wide scope of experience and knowledge and interactions and immersing myself in these environments to be able to see what are patterns, where the pet industry is headed, where pet owners are headed, and being able to find a spot in there that feels aligned for me where I can serve you, the pet owner, or serve my colleagues. In fact, just today I was talking to some colleagues and we were talking about food and they were asking me some questions. And what I told them, because they were like, what do you think about, like Purina and Royal Canin, like the kibble food? And I was like, I'm gonna be factual. It's ultra processed and it serves purpose for a lot of pet owners and dogs. It's convenient, it fits in their budget, it's formulated to meet requirements. It is ultra processed. So what I don't believe in and I don't subscribe to is food shaming. I said I will never go into a room and put my stethoscope down and say, if you really care about your dog, you're gonna get him off that kibble food and shame somebody. Because A, you only know what you know, and when you know better, you can do better. What if I'm the first person who's ever talked to this pet owner about that? That's gonna come in very harsh and hot. And now sometimes some owners need more direct communication, and I understand that. But there's no place, in my opinion, for dog shaming. Because what happens, or food shaming, because what happens is when we food shame, and in fact, I just talked about this a few weeks ago, is I had a consultation with a lovely pet owner. And when she originally messaged me, she said, hey, do you do consultations for people who feed raw? And I said, I do consultations for people who feed a variety of dog food or food options. How can I help you? Like, what interest? And I don't remember exactly what I asked her, but I asked her a clarifying question to get for more information. And she said, okay, thank you. I'm not interested in having help with raw food. I want you to help me find something that's going to fit my dog's health, my goals for them, and support the lifestyle and beliefs I have because we're on the road a lot. And I want something that's convenient to take with me, but I also wanted to check these boxes. And we met. She didn't want to talk about raw food. Imagine if I got that email and immediately shut her down and said, no, I don't work with people with raw. I don't believe in it. I think it's risky, and listed all these things. She would have felt so shut down, not he nor sheard, definitely not felt like a safe space. She definitely wouldn't have booked the consultation with me. And that's not even what she wanted help with. And so we do food shaming sometimes without even realizing it. Like we're picking sides in a war, or we're picking a team for the Super Bowl, and we're unknowingly causing dog owners to not feel safe talking to us. And so they're going to people outside of the profession for this information. And then it's this vicious cycle because then the industry gets frustrated that they're getting information from individuals outside the industry. And it's like, well, did we push them that way? Did we not make them feel safe to have a conversation? And to ask and inquire why they're feeding a certain type of food, what has led them down that path? Are they happy with it? Would they like to know ways to elevate it, to improve it? Do they know the pros and the cons? Do they know the risks and the benefits for all types? I'm not talking raw food, I'm talking fresh food, I'm talking kibble food. Because if you ask anybody, everyone's got an opinion about any type of food. Kibble food, oh, it's processed. You should never, it's ultra processed. You should never feed it to your dog. You're a horrible person. Oh, raw food, that's dangerous. It could have pathogens. Oh, fresh food, it'll never be balanced. And then you can find the flip side of that. Oh, kibble food, it's convenient. Someone's put thought into it and it should be balanced. Oh, raw food, okay, it's not as processed. Oh, fresh food, it's also not as processed, and you have control to have control over the ingredients. Like there's a side for both of them. And what I'm not going to do is I'm not going to pick a side. I'm going to be in the middle. I'm going to support you and your pets and talk to you on what may be the best option and being realistic. And I'm happy to lay out the pros and cons to you. Absolutely. Especially based on your goals and your lifestyle and what you want. And so that may also be a little non-traditional, that I don't pick a side. I try to be very factual about it and also help you meet your expectations. If your dog is chronically sick and ill and they are on an ultra processed food and all they get is ultra processed treats, well, hey, maybe there's a way for us to improve their health and lessen your vet visits and your vet bills if we change their nutrition. Are you open to talking about it? Your dog is eating a form of less processed, whether it's fresh or raw, and your dog's still having issues. Okay, can we figure out where the gap is? Is it nutritional? Is it not nutritional? Would it be worse without the nutrition? And so again, maybe that makes me a little non-traditional, that I don't pick sides like it's a war. I think it should be a safe place, because when it's not a safe place, that's when pet owners like you go and find the information off the internet, and we hope to God that it's good information, or you seek information out from a professional, and I'm going to air quote this. If you're watching this on YouTube, you'll see the air quotes, a professional who claims to be a professional, who maybe has had no experience in the industry whatsoever and went through a very brief certification program where, yes, maybe now they're exposed to more information than the average person. I'm going to be hesitant to say no, exposed, and their heart is in the right place. But we're the industry as veterinary medicine, we could be pushing people that way if we're not holding a safe space to talk and to educate. And here's the thing. When we educate, it can't just be of we don't like that, because that doesn't do anything for the pet owners. If we're going to say we don't like that, let's try and back up why and like really substantiate why we don't like it or why we are for something. And that's fine if you have a preference for the type of food you want to recommend to your patients, but can we back it up beyond that's just what we were taught in school, or that's just how it's always been? Okay. Again, that's when we're allowing these pet owners the avenue to go seek information from places that maybe could be better served information. And so that's why I feel I'm a little non-traditional, or quite non-traditional. I don't food shame. I don't think every dog needs to be on fresh food or raw, because it doesn't fit every dog and every dog owner. It's not in everyone's budget. But hey, how can we help shed light on ways to improve what's in their bowl? Maybe that's swapping out and throwing out all the packaged treats, and it's getting them fresh fruits and vegetables. Where then they're like, okay, I'm doing this and I've noticed a little bit of improvement. How can I take this a step further? Now maybe I'm open to talking about nutrition and doing less processed. And so I'm not out here to tell the kibble companies to go under or to take a hike, because there are a lot of pet owners that it's like that's all they can feed their pets, or that's all they know. but let's educate them on, if you're going to do that, here's the best way to do it. Here are the best options. Here's what to look for. Here's what to avoid. And so while I'm thinking about it right now, I want to invite you, if you're wanting more of that one-on-one support, schedule a one-on-one nutrition consult with me. I'm calling them nutrition lifestyle consultations because yes, we talk about nutrition, but also talk about other things that could be affecting your pet's health that may be in their lifestyle, whether it's their supplements, their stress, their environments, etc. If you're wanting a less hands-on approach and you want a resource, I want to invite you to download The Truth About Dog Food. Both of these links will be in the show notes beneath or the description where you have access to it. You can see if it's a good fit for you. I also at this time want to invite you, if you've not yet rated this podcast, if you're listening on Spotify or Apple, or if you're watching on YouTube, may I please ask for a beautiful review. The more it's reviewed, the more it can get out there so that more pet owners can hear it. So I really appreciate that. And so holding space. And so I will tell you now, I've been seeing my doctor. I'm going to take it back to my doctor and my health. I've been seeing my doctor for about 5 years now. It'll be 6 years this fall. Or no, I'm sorry, it'll be 5 years. No, 4 years this fall. And I've been very happy. I've been very happy that they're taking a non-traditional approach. It's very integrative. They do traditional testing. I do my chemistry. I do my CBC. They look at my organs. They look at my cell counts. I also like that we go beyond that for more information because as my dear marketing expert coach says, data makes decisions. And so I like to look at it as that information can help with intention. And so I like having all that. And so I have seen a drastic improvement in my health. I saw, not that I needed to lose weight, but I saw my weight shift in a very healthy way where I got rid of like an inflammation weight. It was like 3 to 4 pounds. I am rather a petite frame. And so 3 to 5 pounds on me can be a big difference on how things feel on me when I'm wearing them. Also, I saw an improvement in my sleep. I needed less sleep. Less. Did you hear that? I needed less sleep. At one point, I was getting like 9 to 10 hours. If I was getting any minute less than 9 hours, I was plumb exhausted. And now I'm like, okay, as long as I get like 7's kind of my minimum. If I get 7.5, 8, that's like my sweet spot. But I can function on 7 and be fine. My sleep got better, everything, my skin got better. And so I was like, that's where I was rooted in. How can this help my patients? There's got to be more to it than just like throwing the food in their bowl and not thinking twice about it. In fact, today, the same colleagues I was having that conversation with were like, yeah, but do you think it doesn't matter to dogs as much as them eating it because they don't live as long and like look at us and our health? And I was like, but maybe they're not living as long because of that. But, and there are some dogs that eat lower quality kibble and thrive to 17 years old. It's where genetics plays a role a little bit too. You have to also think about other things in their environment. Are they less exposed to pesticides and herbicides and fertilizer? Less stress. What's their immune system like? Are we also challenging their immune system in other ways? So there's a lot to think about that. And said, yeah, but for a lot of our patients, that's all they're eating is ultra processed food for their whole life. That's all they're eating in their food. And if they're getting treats, because they're the type of pet that gets a treat every time it goes to the bathroom, and they're getting 6 or 7 treats that are out of a package, that's all they're eating is ultra processed food or some form of processed food, either from gently processed to ultra processed, depending on what the treats are. So I was like, that's a story in itself. And so there's nothing, going back to the question, is there anything in vet school that I don't agree with? I don't think so. Not that I can think of. I think it was a beautiful foundation for me then to go out into practice, for me to be in the real world and see how things worked. And some of them were very aligned with what I was taught in vet school. And some of them were like, okay, if this was going by the textbook, this is what we would do, but this is not the textbook. This is real life. And then from there, it's like Legos. I've been adding blocks. And what's really cool about Legos, right, is that they don't have to match identically the size or the shape or the color. And so I feel like I've been building Legos these past 11 years, especially these last 5 as being a relief travel veterinarian, and especially these last like 4 years where I've been focused on my health and seeing what certain supplements and certain foods, including and removing from my diet, really did for my health. But I'm like, I know that I am biologically different than a dog and a cat. I know that. That is so obvious, right? But also, what can their food, the type of food, the ingredients that we want to feed or not to feed, how can it affect my patients? And when I see patients who come in and their owners are saying, when I switched their food to blank and blank, this, and this got better, I'm like, Okay, tell me about that. And then I look at the history and I'm like, wow, you're right. You were in here all the time for urinary issues, or you were in here all the time for skin issues, or you were in here all the time for diarrhea, or you were in here all the time for ear issues, or wow, they used to be overweight and now they're no longer. It's a little bit hard to argue with. And so what I'm there for is to support and be like, okay, is this right and tight? Or are there ways that we can like bridge the gap here and make it even better? So now, yes, we've gotten rid of those chronic conditions, but how now do we have longevity? How now do we have a really good life ahead of us that is long and happy and full and healthy? And so that's how I feel like I'm a little non-traditional, or maybe pretty non-traditional. I don't think that any two pets are the same. Any two dogs, any two cats, I don't care if they're from the same litter. They have similar genetics, they're not identical. What may work for one may not work for another. And that's with everything. That's with preventions, that's with vaccines, that's with diet, that is with lifestyle. It doesn't work for every pet. And when we try and put every pet into a box and every dog owner, that's where we miss the mark. Thinking that because it works for this, it has to work for all. And that's just not true. And so being able to look at the pet and the owner that they come with, the pet parent they come with, and treating them individually and knowing that, hey, I saw a patient like this person or like this pet before. Maybe it'll work, and knowing that it may or may not. Also, I want to invite you, if you are a veterinarian, and I had conversations with several of you, that you have been in a traditional setting and you're wanting to branch out, or hey, I want to be a relief travel veterinarian. I just don't know what to do. I also want to invite you that I have the relief travel handbook that I made that I wish I had when I started being a relief travel veterinarian. All the important questions on scheduling and contracts and all that in one resource for you. Also, I don't do many of these, but I will invite you here. I do brainstorm collaboration sessions where we can meet and kind of like open mic and you're like, I just want to pick your brain on certain aspects of career. And the reason I have these set up is that I have done it in the past where I've gone back and voice memoed back and forth, and it has taken 3 weeks to get to the root of whatever the question is or the solution or the feedback. Because I'll send a message and then you'll read it 2 days later and then you'll send it and I'm busy. Or, you think of a question while you're reading this and then you send it. And then it's like, rather than save us both time and be mindful and be really intentional, I also offer those as well. Because sometimes I know having somebody who's a few steps ahead of you can be really, really impactful for your career. And so I want to be able to hold space for that as well. And so what I don't know is I don't know what the future holds. What I do know is that I want to continue to practice in a way that feels very aligned to me, that I can put my head on my pillow at night and know that I did the best for this patient. It doesn't mean I'm anti-pharmaceuticals. It just means being done with intention. And then if we are doing pharmaceuticals, how can we also support the pet's health so that while we're improving this thing right here in time, how can we also protect their health for the future? So this medication doesn't show up as a side effect months later, which we're probably not even connecting. And we're trying to figure out why all of a sudden this dog or this cat has this issue when it's like, hey, let's look at the past history and see what medications have been on. What are their vet visits? Have they been on a slew of steroids or antibiotics or antifungals? And what have we done to help protect their health in the future? And so being able to take that step back. And so I don't see right now, I see me continuing down this path. I'm being able to hold space for traditional and conventional aspects and treatments and more holistic lifestyle, nutritional support, supplemental support. And knowing when to lean into either one of them, I feel like is a superpower because there is a place for both. And sometimes one weighs heavier than the other. And so that's me, the non-traditional veterinarian, and how I got here and how I continue to hopefully show up and to serve pet owners. And the biggest thing I want them to know and to you to know is that this is a safe space to discuss questions or concerns or wishes or lifestyle preferences. And then my only ask is for you to also be open for the education to either say, yes, you are on the right track and here's why, so that you can continue to go down that track, whether it's for this pet or a future pet, or hey, here's a way that we can elevate it. Just being open to have that conversation. So continue to lean in, continue to have conversations with your veterinary medical team. I think that is one of the biggest things we can do is have open communication. That is one of the biggest things that we can do to help advocate for our patients' care and for your pet's care. I hope you found this episode very interesting. I hope that it provided some insight as to how we got here, how I got here. And who knows, maybe it'll be a part two of this, especially if drop some questions. Write me if there's any more of what they call my origin story or my journey that you want to know about. I'd love to know. And maybe there can be a part two.